Hi everyone, my name is Sapna Kedia and I'm a social scientist. I work with the International Center for Research on Women as an Assistant Director for Gender and Social Inclusion. As a part of my leadership project, I decided to work on the issue of engaging men for promoting women's leadership in the health sector. What I sought to do was to speak to men, talk to them about their personal journeys, understand what they think about the women, about the barriers and enablers that women face in their leadership journeys, and to get their suggestions on promoting women's leadership within the health sector and the role that men can play. The reason why I selected this issue was because in my personal life, I've been heavily influenced by men. They've acted as barriers mostly and sometimes as enablers, and I feel that they hold positions of power, and thus we have to work with them in order to make space for ourselves. I feel like it's important to talk to men about the existing kinds of styles of leadership that, in my opinion, are very, very masculine. And we really need to know whether men really understand the barriers that women face and the realities of women's daily lives. That's why I feel that we need to work with men. In short, it's really not possible change decision-making processes, policies, and structures without those sitting at the table taking responsibility. That is why it's key that men are involved. So, as a part of my study, we are reviewing existing literature on men's understanding of women's leadership. Literature is really far in between and few. Nobody is really speaking to men to try to understand what they really know about women's leadership journeys. So, there is very limited literature. We interviewed around 23 men from autonomous government health bodies, from private sector health bodies in India, NGOs and INGOs. We've looked at some organizational policies within these organizations that we've done interviews from. And we hope that by the time this research is completed, we can use this evidence to conduct a social media campaign and to advocate with key stakeholders. Currently, we finished the interviews and we're in the phase of analysis. We're just not there yet where we can really share findings with you, but very initial preliminary findings from some of the interviews that we've conducted and also some of the transcripts that we're looking at is that in terms of men's own journeys, we found that they don't have career breaks, they can travel easily, they can take up jobs that have a lot of travel, they get to opportunities to network more. Some of them did express that they miss out on family time, and they shared that they've worked with women leaders and colleagues whom they found largely to be very hardworking and supportive. In terms of men's own understanding of women's journeys, we found that men don't understand the barriers that women face on a day-to-day basis. They do share that, oh yes, women have more childcare burden. Yes, it's not safe for women to go out on the field late and so on and so forth. But they feel that policies exist within organizations and like maternity benefits, like women are not required to go to the field. If they say they don't want to go, they have that option of not going. So they feel that formally and informally, mechanisms and policies exist within organizations. Some of them also shared that women need to take more initiative and they feel that they are doing whatever they can to take care of their female colleagues. But there was very little articulation of the invisible barriers that women face on a day to day basis that really limit their career opportunities and growth opportunities within the health sector. What we did find is that men who are part of organizations that have a root in social movements and activism, in collectives, are more sensitive. They say that women have the right to leadership positions and we are not doing enough. We need to do more. In the words of one such participant, he shared that it's really about listening, it's about learning what we don't know and what we can do, and then trying to do something about it and actually really doing it. It can really be as simple as trying to be a better teammate. I feel like this quote sort of summarizes the core of the issue of why I've selected to work on engaging men. And also, it speaks a lot to my own experience as a part of the Women in Health leadership journey. I feel like through this journey, I have learned that I don't need to be like any other leader. I feel like I'm already a leader and I can be the leader who I am. I can be vulnerable, I can be authentic, I can be flawed. What I've also learned is that I am a mentor. I've learned that it's important to be a teammate, to share with your colleagues what you are learning. And I've tried to do that over the past 1 year as a part of this journey. And finally, what I'm taking away with me from this journey is that I don't have to do everything myself. Um, we have allies, we should rely on people, and we should build an environment where people can work with each other, can be vulnerable, and can be their own authentic selves. Thank you.